Welcome to the deep dive. Today we're jumping straight into something really vital, and actually it's custom tailored for you.
That's right.
We're doing a deep dive into testosterone blood testing. We've looked at the source material you provided, and it gives a great guide, particularly useful, we think, if you happen to be in Leominster. Now, you probably know testosterone affects muscle mass, but maybe not so much its role in, say, mood, or even how clearly you think.
Yeah, surprisingly broad.
And this simple test, just a blood draw, can offer some pretty profound insights into your overall health.
And what's really fascinating here, I think, is the power this test gives you. It's not just about chasing a number.
Right.
It's a critical diagnostic tool. It helps identify conditions like hypogonadism.
Yeah.
That's basically low testosterone production.
Okay.
And it's absolutely essential if you're monitoring hormone replacement therapy, making sure any treatment is exactly right for your body.
So it helps tailor the approach.
Precisely. It helps address a whole spectrum of health concerns, really aiming for optimal function.
Okay, so the big question then is, who should actually be thinking about getting this test?
Good question.
If you've been feeling maybe unusually tired lately, or noticed a real dip in your libido, or even just mood swings you can't quite explain.
Those are key signs.
Yeah, it's worth considering. We often hear the term low T, and it genuinely impacts both how you feel physically and emotionally.
It really does.
It becomes even more relevant generally for men over 40 just because of the natural decline that happens. And also for anyone managing conditions like obesity or diabetes.
And this brings up such an important point.
Yes.
Why is checking this consistently so beneficial?
Right, what's the payoff?
Well, simply put, catching low testosterone early. That allows for timely interventions, things that can dramatically improve your quality of life.
So being proactive.
Exactly. It's a step against potentially more serious issues down the line. Think osteoporosis or even cardiovascular problems.
Wow, okay.
And beyond the physical, the benefits really extend to your mental health. We're talking improved mood, sharper thinking, and just a noticeable boost in energy levels. It's really about building a foundation for vitality long term.
Okay, that makes sense. Now, for those of you listening in Leominster, let's get practical. Where can you actually get this test done locally, and how do you prepare?
Right, the local angle.
Well, the good news is it's available right there. You can usually go to your local GP surgery, or there are various private clinics in the area too. The key thing is choosing a reputable provider, someone known for quality care. That's definitely a benefit of using local services you trust.
Absolutely. And the preparation. It's pretty straightforward, but it is crucial for getting accurate results.
Okay, walk us through it.
Ideally, you want to schedule that blood draw sometime between 7 a.m. and 10 a.m.
In the morning, right? Why is that?
That's typically when your natural testosterone levels peak during the day, and you get the most accurate baseline reading. Also, always tell your doctor or the clinic about any medications you're on. Some can definitely influence the results.
Good tip.
And for at least 24 hours beforehand, it's best to avoid really strenuous exercise or any sexual activity.
Okay. And the test itself?
Oh, the blood draw is super quick, usually just a few minutes. Minimal discomfort, results, typically back within a few days. Though some private clinics, maybe even in Leominster, might offer faster, like 24-hour turnaround time.
Okay, so pretty accessible. Now, once you have those results back, what do they actually mean? What are we looking at?
Yeah, the numbers. So for adult males, the normal range is generally cited as somewhere between, say, 270 and 70 nanograms per deciliter NGL.
Okay.
But, and this is the important part, these ranges can really vary depending on your age, your overall health, lots of factors.
So it's not one size fits all?
Not at all. That's why it's absolutely essential to have a healthcare professional interpret your specific results. They look at the number within your clinical context, your symptoms, your history.
Right. Makes sense. It needs context.
Exactly. And if we connect this to the bigger picture, what if your levels are low? What happens then?
Yeah, what are the options?
Well, treatment might involve hormone replacement therapy. That's one route. But there are also some really powerful natural ways to potentially boost levels.
Like lifestyle changes.
Precisely. Things like consistent strength training, eating a well-balanced diet, really managing stress effectively, and making sure you get enough quality sleep. These can all make a difference.
Okay.
And looking ahead, things are always evolving. There are innovations like advanced sensitivity assays. These can detect tiny changes in levels. And point-of-care testing is becoming more common, getting results rapidly, sometimes right there in the clinic.
Oh, interesting.
Yeah. So local clinics in Leominster If they invest in this kind of cutting-edge tech and focus on really educating patients comprehensively, they can seriously enhance the services available right on your doorstep.
That's great to hear about local potential.
Yeah.
So wrapping up then, beyond just dealing with immediate symptoms like fatigue or low mood, maybe the final thought for you is to consider how proactively monitoring your testosterone levels could actually be a key piece of your long-term health strategy.
Yeah, think bigger picture.
Right. It's about empowering yourself to maintain that vitality and well-being, really, as you move through life. Something to think about.